I have a question for you. A 28-year-old patient presents to the emergency department with anaphylactic shock after a bee sting. She receives intramuscular epinephrine. Within minutes, her blood pressure rises and bronchospasm resolves. So, which G proteins are responsible for these two therapeutic effects? You will learn the answer to this question after watching this video. Today, we will be discussing G protein coupled receptors as part of basic principles of pharmacology. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. There are three major types of G proteins. 1. GS, 2. GI, and 3. GQ. We will learn about each of them in a moment. You understand these three pathways, you will be able to predict the mechanism of action of drugs instead of memorizing them. Let's look at the GS. When we think of GS, the first word that should come to mind is stimulation. Because, as we will see shortly, the GS pathway stimulates intracellular signaling pathways and cellular activity. But let's ask the question, how? GS-coupled receptors are activated. The GS pathway operates via the activation of the adenylyl cyclase enzyme. The enzyme adenylyl cyclase produced cyclic AMP from ATP. The adenylyl cyclase enzyme is stimulated, resulting in an increase in cyclic AMP. And increased cyclic AMP leads to the activation of the protein kinase A enzyme. Let's set up the equation then. GS equals stimulation. So, which receptors are GS coupled? We will remember them with this sentence. Brave, doctor, heals, very good. So, brave, beta 1, 2, 3, doctor, dopamine 1, heals, histamine 2, very, vasopressin 2, good, glucagon. Now, let's continue with the GI pathway. When we think of GI, the first word that should come to mind is inhibition. Because, as we will see shortly, the GI pathway inhibits intracellular signaling pathways and cellular activity. But let's ask the question, how? GI-coupled receptors are activated. The GI pathway operates via the inhibition of the adenylyl cyclase enzyme. Now you know that the enzyme adenylyl cyclase produced cyclic AMP from ATP. The adenylyl cyclase enzyme is inhibited, resulting in a decrease in cyclic AMP. And decreased cyclic AMP leads to the inactivation of the protein kinase A enzyme. Let's set up the equation then. GI equals inhibition. So, which receptors are GI coupled? We will remember them with this word. MET2, M for muscarinic 2, A for alpha 2, D for dopamine 2. Next up is our GQ pathway. When we think of GQ, the first word that should come to mind is quasatio. What? Yes, because in Latin, quasatio means shaking. Just like the GQ pathway shakes the inside of the cell with increasing calcium levels. And we will use this word to remember. But let's ask the question, how? GQ coupled receptors are activated. The GQ pathway uses the enzyme phospholipase C, not the adenylyl cyclase enzyme. When phospholipase C is activated, inositol triphosphate and diacylglycerol are produced from membrane phospholipid. Increased inositol triphosphate leads to the rise of the calcium, and increased diacylglycerol leads to the rise of the protein kinase C. Let's set up the equation then. GQ equals quasatio. So, which receptors are GQ coupled? We can remember it as HAM1, like a hamburger. So, H for histamine 1, A for alpha 1, and M for muscarinic 1. Now, let's go back to our question. Anaphylactic shock, after a bee sting, receives intramuscular epinephrine, blood pressure rises, and bronchospasm resolves. So, which G proteins are responsible for these two therapeutic effects? The answer is GQ and GS, because epinephrine constricts blood vessels and raises blood pressure via alpha 1 receptors. It also causes bronchodilation via beta 2 receptors. And now you know that alpha 1 receptors are GQ coupled, while beta 2 receptors are GS coupled. And that brings us to the end of today's topic. Now that you have mastered the core functions of G protein coupled receptors, it's time for today's high yield challenge. If you are ready, here comes today's question. How many times does a G protein coupled receptor polypeptide chain cross the plasma membrane? I will be waiting for your answers in the comments. See you later.